Hello, everyone. My name is Bev Bolton. I'm from the Stroke Awareness, from the Stroke Association, and I'm providing you with the Stroke Awareness session this morning. My role is to recruit, train, and support all of our volunteers throughout the South Wales area. So we have volunteers that help out at our local service groups, our local social groups, which are stroke cafes. We also set up info points in the hospital, so they help to replenish the stock within the info points. They help out at community events and things like that. So that's my role, but I'm part of the engagement team. We also provide presentations, and our volunteers also provide presentations to organisations and businesses. So, so what I'm going to be covering today is we are the Stroke Association, who we are, how we were founded, what is a stroke. I'll take you through the FAST test. I'll provide some information on prevention of stroke. I'll give you some information on the impact of stroke. I'll give you information on my stroke story, because I myself have suffered a stroke. And then there'll be opportunities for questions at the end. So we are the Stroke Association. So the Stroke Association is one of Britain's oldest and most successful health charities. It was founded in 1899, and its history goes back well over a century. And during that time, its focus has altered with perceived human need for a single killer disease, tuberculosis. It then went on to support diseases of the chest and the heart, but now it's back to the single devastating condition, which is a stroke. The full story of how the Stroke Association was founded can also be found on the website. So if you go to www.stroke.org.uk, you can read the story there. Plus, there's an abundance of information, resources, support, everything on our website. Okay. So our vision is for there to be fewer strokes across the UK, and for people affected by stroke to get the help they need to live the best life that they can. We're also here to support people to build their lives after a stroke. And we do that by providing services in the community following discharge. So we have our own service coordinators that help with mobility issues, communication, help to support with putting things in the house to help with aids, and things like benefit information and so forth. So yeah, this is what we do. So we provide specialist support, we fund the critical care, and the research. We campaign for people affected by stroke. So we talk on an annual basis with the Welsh Government in trying to push forward the importance of stroke and the need to decrease our numbers, really, of people suffering a stroke. We also have a large group of volunteers within Wales that help out, like I said earlier, with the support groups, with the info points, helping out presentations, attending community events, fundraising events, and so forth. Plus, we've also got our own fundraising team that work within the area. So they work with the large sporting events like the Cardiff 10K we've done recently. So we support that, and we also fundraise during those events. So probably going to ask, what is a stroke? But we're going to have a look today at what a stroke is and what it actually means for people and the effects. So a stroke can happen to anyone. As you can see, there's Max, Elise, and Paul. They're all stroke survivors. They're all the variety of ages, and it's important to remember that stroke can happen to anyone of any age at any time. In the UK, somebody has a stroke every 5 minutes. Although it's more common in older people, people are having strokes earlier in their lives. And I found out recently that the average age now for people to who are suffering a stroke is between the age of 45 and 59. So people are getting younger now. I don't know if it's due to stresses of life and diets and lack of exercise. We're unsure. This is why the research team look into all of these aspects. And although it's more common in older people, people are having strokes early in their lives, like I said, and around in 4 strokes happens to people of working age or under the age of 65. And babies, children, and young people can have strokes too. And there are over 400 childhood strokes a year in the UK. Actually, babies can have strokes in the womb too. So, yeah, if there's any issues there with high blood pressure or clotting, obviously through the mum, then the baby could also suffer that. So, yeah, it's really surprising, really. So, yeah. So, a stroke is the damage to part of the brain. So, it's caused by a problem with the blood supply to the brain, a blockage or bleed in the arteries which supply blood to the brain. It's something that happens quickly and strikes suddenly. And it's actually called a brain attack. So, like we have a heart attack, it's a brain attack. For your brain to function, it obviously needs a constant blood supply because it provides vital nutrients and oxygen to the brain cells. And a stroke happens when the blood supply to part of the brain is cut off and brain cells are damaged or die. For many people, a stroke happens suddenly and without warning, and often there's little time to prepare for one. And strokes are sudden and have an immediate effect, and they can be life-threatening, similar to a heart attack. And like I say, a stroke is in fact a brain attack. So these are the types of strokes that people can suffer with. So the most common is the ischemic stroke. So that's the blockage, so that's the blood clot. So generally 85% of people will suffer this type of stroke. And the other then is the hemorrhagic stroke, which is a bleed. So you hear of brain hemorrhages, that's basically a stroke. Okay, so 15% of people in the UK suffer these type of strokes. And expressed in the last slide, a stroke is a brain attack. It happens when the blood supply to part of the brain is cut off and killing brain cells. And the damage to the brain can affect how the body works. It can also change how you think and feel. And the effects of stroke depend on where it takes place in the brain and how big the damage area is. So like I say, the different types of stroke are the ischemic, the stroke, the hemorrhagic stroke, and a transient ischemic attack, which we'll look at a moment. So an ischemic stroke is caused by a blockage cutting off the blood supply to the brain. You may also hear it referred to as a clot. In ischemic stroke, the blockage can be caused by a blood clot forming in the artery leading to the brain, or within one of the small vessels deep inside the brain. And this is the most common type of stroke. A hemorrhagic stroke is caused by a bleeding in around the brain, and you may also hear it called a brain hemorrhagic or a brain bleed. Hemorrhagic stroke tends to affect younger people than ischemic strokes and is most common in people between the age of 45 and 70. And most strokes in the UK happen over the age of 70. So then we go on to the transient ischemic attack, So this is known as a mini stroke or a TIA, where the blood is briefly interrupted for a short time. Effects don't last longer than 24 hours, but it's still important that you treat a TIA stroke as an emergency, because without treatment, it could lead on to a full stroke. It's basically a transient ischemic attack is a prior warning that you're more likely to be receiving or suffering from a full stroke. Okay, so without treatment, like I say, if there's no treatment, by 3 months, you're 17% chances of receiving or suffering a full stroke. Okay, so yeah, so it's basically a TIA is basically the same as an ischemic stroke, but obviously the symptoms last a short time. The stroke symptoms, because the clot is blocking the blood supply in your brain, then obviously you may notice things like your eyesight might be going, your speech might go for a short time. You might have a weakness on one side for a very short time, but it's not long lasting. It can last an hour. It could last up to 24 hours. Okay, but like I say, it is classed as an emergency, and you should seek medical attention for assessment. Okay, so that's that one. I'm sure everyone's heard of the FAST test. So this is the one that you tend to see on the TV. I know the NHS put a campaign out recently for the FAST test. So this is the information that we put out. So it's the act fast and call 999. So these are the most common symptoms of stroke, but there are other varieties of symptoms. But these are the most common, and these are the ones that will be the most recognizable. So if you see that someone's face has fallen on the one side, or they're unable to smile, then yes, that could be classed as a stroke. They could have arm weakness. They may not be able to raise both arms or one arm. Their speech may be slurred, or they may have trouble understanding what you're asking them, and things like that. Okay, so if you see any single symptom of this, then you need to act fast and call 999. The paramedics are trained in basically, they will know which hospital to take you to. Okay, so they assess you. If they believe that you have suffered a stroke, then they will take you to the nearest stroke unit. Not all hospitals have a stroke unit. Okay, and not all A&Es hospitals have a stroke unit. So it's always best to call 999 in this instance. There's no way of knowing if symptoms will pass or get better when they first start, so you need to seek immediate medical help, even if the symptoms pass. A stroke is a medical emergency, and the quicker the person arrives at a specialist stroke unit, the quicker they'll receive the appropriate treatment. Okay, so we do, like I said, have other symptoms of stroke. So that you could have suffer from sudden weakness or numbness on one side of the body, including the legs, hands, or feet. Difficulty finding words or speaking in clear sentences. Sudden blurred vision or loss of sight in one or both eyes. Sudden memory loss or confusion and dizziness. Or you may have a sudden fall. And a lot of people say that they have a sudden severe headache or migraine, which they feel very unwell. This can be a sign of stroke as well. So if you see any of them signs as well, please call 999. All right, like I say, our ambulance paramedics are trained in stroke and will take the person to the best stroke unit, the closest one as well to you. So stroke prevention, we're going to go on to stroke prevention now. There's a variety of areas that we need to look at, okay, as regards to preventing stroke. The biggest for us is high blood pressure, also AF, which is atrial fibrillation, which is an irregular heartbeat. That's another indication or risk to receiving a stroke. So we've got others as well. Hormone contraception or HRT could be another risk. Heart disease, inactivity, alcohol, substance or drug abuse, your age. You may have received or suffered a previous stroke or TIA, diabetes, family history, ethnicity, obesity, high cholesterol, and smoking. Okay, so they're all there listed. So I'll go on to further details with these now. Okay, so hypertension or high blood pressure is one of our biggest. So there are over 9.5 million people in the UK diagnosed as hypersensitive with high blood pressure. And for every 10 people diagnosed with high blood pressure, 7 people remain undiagnosed. This is more than 5.5 million people in England alone. And high blood pressure is a contributing factor in around 50% of strokes in England, Wales, and Northern Ireland. 120 over 80 is generally accepted as normal, and 140 over 90 or higher is high. However, blood pressure naturally increases with age, and your GP can check if your blood pressure is within a normal range. Wales has the highest percentage of people with high blood pressure per population, and Northern Ireland has the lowest. So then the next one then we go on to is the hormonal contraception and HRT. The estrogen in the pill may cause your blood to clot more readily. If a blood clot develops, it could cause deep vein thrombosis, like a clot in your leg basically. Pulmonary embolus, a clot in your lung, stroke or heart attack. And the risk of getting a blood clot is very small, but your doctor will check if you have certain risk factors and make you more vulnerable before prescribing the pill or HRT. Heart disease is another one. So problems like heart valve disease and heart attacks can increase your risk of a stroke. Having treatment for your condition and regular checkups will help to keep your risk as low as possible. Atrial fibrillation, AF, is a heart condition that causes an irregular and often abnormally fast heart rate. There are 1.2 million people with AF in the UK. AF is a contributing factor to 1 in 5 strokes in the UK. Basically, what happens is when you have an irregular heartbeat, when the heart misses a beat, then the blood pools in the heart chamber, and then when the heart starts beating again, then obviously that blood is being moved around the body, and that blood could contain a blood clot, so that will go through your blood vessels and up into your brain. Or there's risk of that. Okay, so that's atrial fibrillation, the risks. Warfarin or blood clotting drugs can also blood thinners can be used to reduce the risk of clots forming, but they continue to be underprescribed. And in the UK, around a quarter, 24% of eligible patients with AF do not receive blood thinning drugs. Over 7,000 strokes could be prevented every year, and over 2,000 lives saved every year in England alone if AF was adequately treated. And the following could be a sign that you have AF. You may have palpitations, being aware of your heart that's beating fast, that is, breathlessness, chest pains, fatigue, or you may have no symptoms but an irregular pulse over 1 minute. You may also have a hole in the heart. I've been checked for this. So there's a leakage there, so that can cause clots as well. Okay, so but some studies have shown that a hole in the heart is someone with a hole in the heart is at no higher risk of stroke than someone who does not have a hole in the heart. But it's one thing that they check as part of your treatment course after. Another one is inactivity. Moderate exercise can reduce your risk of stroke by up to 27%, and studies have shown regular exercise to be as important to stroke prevention as medication. Physical inactivity and sedentary lifestyle increases your risk of an ischemic stroke by 50%. And regular physical activity lowers your blood pressure, helps balance fats in your body, and improves your ability to handle insulin. Exercising will help you lose weight. We all know that. Drinking alcohol. The government's alcohol guidelines have recently changed. So both men and women should not regularly drink more than 14 units per week, and this should not be spread evenly across the week. People should also have several drink-free days. 14 units equates to 6 pints of 4% beer and 6 glasses of 13% wine or 14 glasses of 40% spirit. 1 or 2 heavy drinking sessions can increase the risk of death and long-term illness. And 1 in 3 adults in the UK drank more than recommended at least one day in the last week. And drinking over the recommended weekly amount of alcohol was most common among adults aged between 55 to 64. Regular consumption of large amounts of alcohol greatly increases your risk of having a stroke. And regularly drinking large amounts of alcohol increases your blood pressure and could cause diabetes, obesity, and trigger atrial fibrillation. And then we come to substance misuse. So cocaine and amphetamines use poses a particular high risk of stroke due to the dramatic and sudden spike in the blood pressure it causes. And a study in 2012 found that 1 in 5, 20% of those under 45 who had a stroke had used illegal drugs. Cocaine increases your risk of stroke in 24 hours following use because it thickens your blood and increases your blood pressure. Age is another one. That's the single most important risk factor for stroke. People are most likely to have a stroke over the age of 55, but as I mentioned earlier, the average age now starts around 45. And by the age of 75, 1 in 5 women and 1 in 6 men will have a stroke. In England, Wales, and Northern Ireland, the average for men to have a stroke is 72, and for women is age 78. In Scotland, it's age 71 for men, and for women is age 75. And around a third of strokes happen in people of working age, and they're actually between age 20 to 64. If you've had a previous stroke or a TIA, you're more at risk of having a stroke. 1 in 12 people will have a stroke within a week of having a TIA. Diabetes, type 2 diabetes, almost doubles your risk of stroke within 5 years of diagnosis and is a contributing factor in up to 1 in 5 strokes in England, Wales, and Northern Ireland. Persistently elevated glucose levels contribute to the buildup of plaque or cholesterol in blood vessels. This plaque is made up of bad cholesterol, protein, and cellular waste and is called atherosclerosis. This plaque sticks to the blood vessel walls and impairs blood flow, which can lead to stroke. Black people are twice as likely to have diabetes and high blood pressure compared to white people. This may contribute to a higher stroke risk in black people. And people with their origins in South Asian countries like India, Pakistan, Nepal, Sri Lanka, and Bangladesh are more likely to have a stroke at a younger age than white people. People with South Asian origins are more likely to have high blood pressure, high cholesterol, and diabetes than white people. These are all factors that increase the risk of stroke. You could have a family history of stroke, even though there's no proven genetic link for stroke, but we often see stroke that runs in families, and this could be due to similar lifestyles in the same family or due to other generic inherited conditions, which can increase the risk of stroke. And in general, people from deprived areas have an increased risk of stroke. Ethnicity, I've just touched on this as well. So black people are twice as likely to have a stroke and at a younger age than white people. And this is mainly due to the high prevalence of high blood pressure, diabetes, and sickle cell disease. They're twice as likely to have high blood pressure and diabetes than white people. Sickle cell disease mainly affects people of African, Caribbean, and Asian and Mediterranean heritage, and a quarter of people with sickle cell will have a stroke before they're 45. Obviously, obesity, then, that's another big one. So that will increase your risk of stroke because obviously the level of cholesterol or bad cholesterol that you have in your body, and it can also cause high blood pressure. So then we go on to high cholesterol. So cholesterol is a fatty substance in the blood. It's vital to the healthy working of the body, but too much cholesterol in the blood can cause deposits on artery walls and restrict blood flow. It can also raise the risk of developing a clot, which can lead to a stroke. And the use of statins in individuals with a high risk of cardiovascular events reduces the risk of stroke by 25%. reducing cholesterol level by 1 millimeter OL reduces the risk of stroke by 21%. Cholesterol can be lowered with a healthy balanced diet, exercise, and the use of statin medication. So when I had my TIA, my my cholesterol level was over 6. For a woman, normal bad cholesterol, normal cholesterol level should be no more than 4. So obviously, yeah, that was one of the main factors of me receiving the TIA. And the most common causes of high cholesterol are eating a diet that is high in saturated fat, smoking, lack of exercise, higher alcohol intake, liver and or kidney disease, genetics as well. So the last one then we've got is smoking. So smoking doubles your risk of stroke. Smoking causes your arteries to fur up and makes a blood clot more likely. So stopping smoking is one of the most important things you can do to reduce the risk of stroke. Tobacco contains 7,000 toxic chemicals and damages cells, and it travels around the body and increases bad cholesterol and decreases good cholesterol. Okay. So yes, there's quite a lot of risk factors there linked to stroke. So, like I say, I'll go through, we got the what causes a stroke. Like I say, I've gone through all of these. So is the age, health problems, AF, high blood pressure, diabetes, high cholesterol, lifestyle, smoking, being overweight, drinking too much alcohol, being inactive, family history and ethnicity. Okay, so obviously, by quit smoking, controlling your weight, watch your units, checking your pulse on a regular basis, exercising regularly, and checking your blood pressure on a regular basis. It's very important. I believe that if you went to a pharmacy, you could have a free blood pressure check there. There are organisations that are out in the community as well that are run by the NHS, and they're able to come out to organisations and businesses and check your blood pressure, and also check if you have atrial fibrillation, because they have a machine that can check your heartbeat basically. So the things that you can do to reduce your risk of stroke is obviously drink alcohol within the safe limits, get help to stop smoking, keep to a healthy weight, eat a healthy diet, be as active as you can, and get regular health checks. So the impact of stroke then. So these are the figures that we've got. I have got more figures here, which will go into more details as well. So in the UK, there are more than 100,000 strokes patients, that are admitted each year. So you must remember as well that some stroke patients are not admitted to hospital. I wasn't admitted to hospital. I had community care. So those figures could potentially be a lot higher. There are over 1.3 million stroke survivors in the UK at the moment. The cost to our society is 26 billion a year in the treatment and care of stroke survivors. Stroke is the 4th biggest killer in Wales and England, and the 3rd biggest killer in Scotland and Northern Ireland. And almost 2/3 of stroke survivors leave hospital with a disability. Okay. So in Wales, there are actually 70,000 stroke survivors at the moment in Wales. And they estimate that 7,400 people experience a stroke each year. And it causes 1,800 deaths per year. So, it's, they are very, very high figures. And this is why the Stroke Association, their aim is to basically lower those figures now, to try and get them less people suffering strokes and being admitted into hospital. So there's a little bit here about the brain and how the different areas are affected. So if, for instance, okay, so let me just go through. I'll just explain a bit about the brain. So obviously the brain has two hemispheres, the right and the left. The right side of the brain controls the left side of the body and vice versa. Both hemispheres have control centers or areas that control some of the same functions, for example, on both sides. And there are control centers for movement. So this is why often stroke survivors will only have movement problems with the one side. Vision, hearing and memory. So say for instance you had your clot in the right side of the brain, then it generally can affect the opposite side. Okay. For some functions, you will only find these on one hemisphere as presented on slide. And perhaps the most notable are our language centres, which for most people sit on the left hemisphere. Therefore, a stroke survivor with a language problem will most likely have the weakness on the right-hand side. It is important to note that for some left-handed people, their language centres may sit on the right hemisphere. And because of this, we now say that the language centre sits on our dominant hemisphere, the one opposite our right in hand usually. And thus, depending on which side the stroke occurs, will depend on the type of effects the person may have. So for instance, my stroke was towards the rear, so that affected my vision. It affected my my speech, and it to some level it's affected my memory, and also it's at the time it affected my understanding as well. Okay, so yeah, these are all the different areas and the importance of where, depending on what side the stroke the damage is, it's normally the opposite side then that is affected. So yeah, so as you can see, this all broken down into different areas again then. So the frontal lobe affects your behavior and your motivation. Your temporal lobe, which is the middle section, affects your memory, emotion, and understanding language. Your cerebellum is the balance and coordination. So as you can see, that's right at the bottom. So this is generally where obviously your blood vessels come in. So it could be more than likely that area is affected first. Okay, so this is why a lot of people have problems with their mobility and their balance following a stroke. And then the occipital lobe, which is understanding what you see, so that's your vision. So when I had my TIA, the temporary damage was at the back with my occipital lobe, and it may then affected a bit of my understanding as well, because I couldn't understand my family when they were asking me questions. I thought I could, but I was taking a while to answer, but I'll go on to that when I explain my situation. Okay. So, lived experience of stroke. So 98% of stroke survivors told us their lives had been affected by stroke, and many of these people felt this impact was significant. More than a third of working age stroke survivors give up work after their stroke. It could be due to their speech, their vision, their understanding, their obviously balance, their mobility issues as well. So yeah, it's a massive impact on life. And for 69% of people, stroke impacted their independence, obviously, for all of those issues that I've just mentioned. And over half of stroke survivors told us their relationships have been impacted by this stroke, but only a third assessed accessed relationship support. 64% of stroke survivors told us their hobbies had been impacted since their stroke. In 2018, the Stroke Association conducted the largest ever survey of stroke survivors and their carers to find out more about their lives. And over 11,000 people affected by stroke in the UK took the time to share their stories with us. So this is how we know the everyday experience of those living with the effects of stroke. This is, and sometimes it can last a lifetime. And over a third of those who shared their story with us told us that they had to give up work as a result of their stroke. And 69% felt that their stroke had a significant impact on their independence. So this is rebuilding lives after stroke. So there is a majority of people do have some high level of recovery following a stroke. The brain is clever. So if you suffer a stroke and obviously the signals are blocked, then the brain will work its hardest then to find another route then to allow for those signals to pass through to the correct area. This is why we encourage mobility, speech and language, and any other support following discharge from a hospital, because it is important that people continue to exercise those areas and carry out your speech therapy and so forth, so that it gives a chance then for those signals to start working within the brain to find a new pathway. Recovery can be tough, but with the right specialist support and a ton of encouragement and determination, the brain can adapt after stroke. It'll, like I say, it will rewire itself, and it'll allow you to improve your skills, such as walking, talking, and using your affected arm or legs, your limbs. And this process is known as neuroplasticity. And it begins after a stroke, and it will continue for years. So like they say, people say, don't they, that, if you don't use it, you lose it. So this is why we encourage all of our stroke survivors to take part in exercise and practice their speech and their communication and things like that. Not everyone can make a complete recovery, but there are improvements from when they first suffer their stroke. They with progress, they can they build their individual goals, they can get stronger, they can become more mobile or more independent. And with the right support, many people can gain their confidence and find ways of doing things and return back into work. And that help is provided by ourselves, really, because like I say, we have our own stroke coordinators within communities, and also we have stroke support groups where they practice things like mobility and speech and language and all of those type of things. So yeah, it is our community support is amazing, really. So I'll go on to my experience of stroke. I did mention to you that I have received, I suffered a TIA, which is classed as a mini stroke. I think I had prior warnings to that. I had prior warnings, I think, towards the end of September 22, and I was driving to work, and I all of a sudden, every now and again, my vision would be going, and then when my vision come back, I couldn't tell the distance between the car in front of me. So it's quite a scary situation there. I didn't feel safe on the road. So my first protocol was my local hospital. I didn't think I had a stroke. I just thought I was tired or stressed, or I was just having a funny turn. So I went to my local A&E, but they were unable to help me there because of my symptoms. So I then had to go to the Grange in Cwmbran. So with blood tests and so forth, nothing came up on that. So they just put it down to stress, tiredness. So I went home. And then in February of 2023, I was sat with my family. They were in the living room with me, and we were watching a film. And the same thing happened to me. It was as if I'd zoned out, basically. And when my vision come back and my awareness come back, I'd missed quite a big part of the film. And there was a dramatic event happening on the film, and I missed the lead up to it. So I turned to my husband and asked my husband, what happened there? And he just said to me, "Are you okay?" And I thought he meant, "You okay? You're watching the film with me?" But I said, "Yeah, I'm okay. I'm fine." I felt a little bit drunk, to be honest. That's how I can explain it. So he said, "No, Bev, are you okay?" I said, "Yeah, I'm fine." And then my children were sat opposite me, and they stood up really concerned, asking me questions. And I thought I was answering them, and I thought I was speaking normally. And then all of a sudden, when I looked at my husband, he was in double vision. And then they were saying to me that, "Mum, you're slurring. You're taking ages to answer our questions." And I honestly thought, I, I, it just felt like I was drunk, and I had no alcohol or nothing. But that was the feeling. So I didn't go to hospital because I just thought I'd never heard of a TIA before and a mini stroke. So I just thought I was just going through one of them situations like I was going through when I was driving to work. So I thought nothing of it. So then it passed then. I say about 45 minutes later, all of those symptoms passed, and I felt normal again. So I went to work on the Monday, speaking to my colleagues in work. I wasn't working for the Stroke Association at the time. I was working for another organisation. And they advised me to go to the doctors. So that morning I went to the doctors, and my GP put me on blood thinners and cholesterol tablets straight away. So I asked why, and he said, "Well, you've suffered a TIA." And I didn't know what that was. So put me onto a consultant. That Thursday then, at my first telephone consultancy, and numerous tests then. So I had ECG, blood tests, I had my heart tests for everything like that. But the only thing that came back was my high level of cholesterol. So that's the only thing I can put it down to, was that I'm not overweight, so I didn't think about cholesterol at the time. Must have had a bit of high blood pressure because I know I was stressed because I was running a wedding business as well around that time, so I was coming to the end of it. So I haven't had anything since, luckily. But I continue to take my blood thinners and my cholesterol tablets. But it's a scary thought, because if I hadn't have gone to the GP on that Tuesday, then it is likely that I could have suffered a more serious stroke. It has left me with my vision has decreased slightly, and my short-term memory, is not as good as it used to be. So so it can leave you with certain things, But all in all, I'm pretty healthy at the moment. So just thought I'd share my experience. So because TIA is, like I say, quite common, and some people might think of it as just being, having a funny turn. And you never know, you might have experienced that yourself. So just be aware. Okay. So thank you for that. Thank you for listening to the presentation. It's all a bit strange because I can't see you, but I'm gonna I'm going to not share my screen a moment now, and then if you've got any questions, then I'd be happy to to answer them. I'm not sure if you can put them in the Q&A, or if you're able to verbally ask the questions. But yeah, thank you for your time. There's a lot of information here. There's different ways and you can help as well. You could, if you want to, go onto the Stroke Association website, stroke.org.uk, and make a donation. There's the digital feedback form is there as well with the QR code. You can find us on Facebook, Stroke Association Wales. You can follow us on Twitter, Stroke Wales. We're also on Instagram, and we have a YouTube channel. On the YouTube channel, there's videos of people's experiences, as well, their treatments, and the exercises, and a variety of things that's on the YouTube channel that you can access. Anyone can access that. So yeah, okay. So thank you for that. So I'll come up my screen now, and I'll see if there's any questions and see if I can answer as many as possible for you. Okay, I have a question here from Frances. She said, concerns me that emergency services are not good, and I've heard stories of people having a stroke being left in a corridor for over 24 hours, which is a crucial time. What is your advice if this happens? This is why I say that if you suspect anyone of suffering a stroke, to ring 999, so that the paramedics can assess the situation and they can take you then to the nearest stroke unit. What we find, some people self-present at A&E, and those hospitals are not able to help because they don't have stroke units, so they haven't got the treatments and so forth. So we've known people to be sat, like you say, in corridors or in beds for days and days and days without the crucial treatment, because they haven't gone to a stroke unit, and obviously they're waiting for a bed in a stroke unit, or we're waiting for that transfer. So so the only advice I can give is to make sure you ring 999, and ensure that the paramedics are taking the stroke patient to the correct stroke unit within the area. We have got a campaign at the moment as well, so we're working with Welsh Government to prioritise stroke sufferers with the ambulance service. So we're trying our best, because we see this happens all the time. Okay, and another question then. Okay, I help a lady who has a stroke, who had a stroke, to sew again, use a machine. Her problem is that she has no control of her stroke side arm. It can shake uncontrollably. Do you have any exercise or advice that might help? Right. Yes, we have exercises on our Stroke Association website. It's normally I think it's under the support or resources area. There's an abundance of exercises on there that can help with mobility, balance, speech, and everything. Okay, so so I'd suggest that you go onto the website and basically have a look at those exercises to see if there's anything that's suitable then. If for instance that lady who's suffered the stroke is still having problems, then she could possibly be referred to our service coordinators, who may be able to provide some sort of information or advice, or even treatment then. So it depends on how severe it is, but the exercises generally do help, because, like I say, if you don't use your limbs enough, then it'll be harder then for the brain to make those new pathways. So is there any more questions? I think I've only got these 3 here. Is there any more before we go?
Well, if there's no more questions, I say
That's
thank you
fine.
very much, Beverly.
That's all right. That's fine. It
And
is a lot of information to be provided, and you know there is more. But like I say, you know, it would take us over an hour and a half to 2 hours of the only information we have. But I hope obviously you've you've taken some advice from it and that you know, and please contact you know the stroke association if you feel that you know you have anyone that you know that is still suffering from the effects of stroke and they may need some additional support or advice, or you know, or that they could be signposted in, you know, in the right way really, so that they receive everything that they need. So yeah. Okay.
yeah, just to echo the message in the chat there, it's been
uh,
very
fa-
informative. Thank you very much.
Thank you. Thanks very much. Thank you for allowing me to speak today. All right.
All right, then I'll bring the session to a close and I'll end it
Oh,
now.
thank you very much.
Thank you very much. Bye-bye.
Bye.